So before coming in for the extubation, I've made sure to take proper PPE precautions. So I've washed my hands, gloved and gown, make sure I have a face mask as well. Scan the chart for any pertinent information, make sure I have the right patient. I'm also going to go ahead and, while they're connected to the ventilator, go ahead and pre-oxygenate them with 100% FiO2 for 2 minutes. During this time, I'm going to make sure to suction both the oral pharynx and inline sections. So right now the section's connected to this guy, pretend that it's on, and I'm going to advance down. And suction. All right, then I'm going to go ahead and put it on my yank hour section. And at this point in time too, I'm also going to make sure that the patient is sitting at least in a semi-Fowler's position. More upright the better, just so we can make sure that we don't have secretions falling back if they're not needed. I'm going to go ahead and suction in this side. And then I'm going to go ahead and suction on this side. All right, so now that I've gone ahead and sectioned him, I'm going to keep it close just for any after withdrawal. I'm going to go ahead and I want to use the self-inflating bag to do the positive pressure to be able to do the cuff length test. So I'm going to go ahead and get this started. I'm going to remove the ventilator, go ahead and attach the self-inflating bag. I'm going to go ahead and do the cuff links under positive pressure. So I want to give the patient a nice deep breath. And I can hear beautifully, going to go ahead and re-inflate the cuff. I could hear the air coming out, so we're all good on that accord. I'm going to be giving him some nice big breaths since he's pre-oxygenating as well. So since he passed the cuff link test, I'm going to go ahead and remove the mask and unsecure it from the patient. And then under positive pressure, I'm going to go ahead and give one big breath in. Lilia, could you give a big cough for me? Oh, thank you. Perfect. At this point, I'm going to make sure that I'm on suction. I'm also going to make sure that there's a towel on top of the patient just for when you fly off the tube. It doesn't get all over the gown and the covers. Suction if necessary. Make sure that I have a nasal cannula nearby as well. So we're going to go ahead and put on whatever FiO2 they were on the ventilator onto the patient via nasal cannula. And just so there's a little bit of consistency going across. I'm also going to monitor patient's vitals, make sure, let's just say they were on 5 liters, that they're not desatting or anything and they're doing well. Next step is going to be to go ahead and chart. This is not going to stick on, but you get the visual. The patient is going to go ahead and just be under a little bit of a careful eye, but make sure that they're getting the oxygens and their sat stay up, and make sure I chart everything before I leave.